Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2022. It's been a wonderful hybrid conference so far with lots of new, exciting information popping up. Rheumatic diseases, including spondyloarthritis, commonly affect women of childbearing age. We try to achieve disease control when prescribing medications to these patients and monitor side effects or response to therapy. But in addition to these interventions, we also consider reproductive health issues that can have an impact on fertility. One of the abstracts on this topic that caught my interest is abstract number 1673. And joining me today is Dr. Sabrina Hamroun to talk more about their study entitled Preconceptional NSAID treatment exposure is associated with a significantly longer time to conception in women with spondyloarthritis. Hello, Sabrina, and welcome to the discussion.
Hello, thank you.
Could you tell us more about your research? Could you walk us through it? Important things, important points that you think you want to tell those listeners out there.
Yes, of course. This study aimed to determine factors associated with time to conception in women with spondyloarthritis. Um, this this disease affects regularly women of childbearing age, and we would like to understand more on their reproductive health and factors impacted the fertility in women with the SpA. And to meet this goal and this research question, we did an analysis of patients who were included in the GR2 cohort, which is a French cohort, an observational prospective multicentric cohort in France. And we the main endpoint was time to conception, and we did a Cox model or survival model to understand factors associated with time to conception in these women. And in the analysis, we found that when we analyze the impact of disease duration, disease activity, current smoking, body mass index, age of patients, and exposition to different treatments, we found that the two factors which were associated with time to conception are age of the patients and also the exposition to NSAIDs. Patients who were exposed to NSAIDs had an increased time to conception 2.6-fold in comparison with women who were not. So the main message of this study is to keep in mind the deleterious impact of NSAIDs on fertility, and to discuss the discontinuation, the supervised discontinuation of NSAIDs in women with SpA who have difficulties to conceive.
Okay, so thank you. Thank you for that. I understand that this is the first among its study in regards to looking into fertility issues in women with axpa, right?
There are we performed a systematic review of the literature on this topic, and we found that of 21 studies on reproductive health in women with SpA, only 4 addressed fertility, and these studies were all retrospective studies. More recently, there is just one study that look at the fertility with the prospective design, but there is a limited knowledge on this topic in women with SpA.
Okay, so it's really a good topic because usually we see, well, before, because it was initially thought of that spondyloarthritis is more commonly seen in men, and now we're getting to see the differences in among the genders in terms of presentation, and now in terms of fertility issues. So it gives us more information about, you know, how the importance of giving or considering giving these medications to our female patients, because sometimes, you know, when we give the medications, or most of the time, we only consider the after, you know, like not the preconceptional considerations, but, you know, just when patients get pregnant, or, you know, you those kinds of considerations. So um were you was there any possible explanation, or did you see any possible explanation as to why NSAIDs were associated with a longer time to conception? I mean, age, yeah, it's understandable, but with regards to NSAIDs, were you surprised, or was there any explanation that you could think of in terms of the results?
Yes, the results are not really surprising given the dysovulation described in the literature with NSAIDs. NSAIDs have an effect on prostaglandins, and prostaglandins are involved in both ovulation and implantation of the fetus. So that's why NSAIDs have a negative impact on fertility, and that's what we see in this study. There is also in the literature a description of a dose effect of NSAIDs, especially meloxicam. In the study, they found that there is a dose effect of meloxicam on dysovulation. So there are some observations of this negative impact in the literature, but it is the first time we describe this in SpA patients.
Yeah, right. Yeah, good. And it was really seen in your cohort, right?
Yes.
Okay, so you've mentioned about meloxicam. I don't know if it's also part of the study, but were you able to see that, or characterize the type of NSAIDs that your patients in your cohort received, that including the dose probably, or the duration that the NSAIDs were given?
There are unfortunately there is some missing data on the dose of NSAIDs patients used in this study. So we don't have enough information to address this topic. And regarding the type of NSAIDs, we could not do sensitivity analysis to evaluate the specific impact of each class of NSAIDs because of a lack of statistical power given the limited sample size. We just have 88 women, so we could not do all the analysis we would like to do. But we plan, the cohort is ongoing now, so we wish to have more and more patients in this cohort to have more statistical power and to do more to refine the results, to do more statistical analysis to refine the results. But
Yeah.
it's a good question.
Yeah, actually, I was going to my next question was actually what you answered. I was going to ask if there were plans for future investigation, since as you've mentioned, there's the study has a small sample size, but you know, it creates you know, even on the practical side of things, like for me, I would, when I saw your study, I was like, okay, you know, maybe we should really consider these things, including medications particularly among our young patients. And we know like NSAIDs are one of the first line therapies that we give for spondyloarthritis. So it's really a good study. So thank you for doing that. Okay.
Thank you.
All right. So I just have a last question before we
Yes.
probably wrap up the discussion. So what do you think will be the impact of, although the sample size is still small and the study is still ongoing, but what do you think will be the impact of your findings in the NSAID prescribing practices of rheumatologists towards their female spondyloarthritis patients?
I wish that rheumatologists will keep in mind the negative impact of NSAIDs on fertility in patients, in SpA patients, and to discuss on a case by case basis the possibility to switch to a therapeutic switch in women who have difficulties to conceive for a long time and without any other source of subfertility than a regular use of NSAIDs. I think that we should have this in mind, that NSAIDs could be a source of subfertility, and to discuss for every patient, really on a case by case basis, the indication of switch of a therapeutic switch.
Mhm. Okay, so you've really raised a good point there with regards to the NSAIDs as, you know, a possible consideration for taking a longer time to conception or in terms of fertility. And yes, I do agree that, you know, it's really an individualized treatment, and I guess it's really the shared decision making process between the physician and the patient as well.
We also have to consider the age of the patients. If a woman has more than 35 years old, for example, and has difficulties to conceive for a long time, I think that the therapeutic switch could be favorable for them. So yes, it's always a shared decision with the patients.
Okay, so thank you very much, Sabrina, for joining us today and sharing your time with us to, you know, to discuss more about your research. And we will look out for more of your findings in the future.
Thank you.
So thank you very much. Okay, so that has been a very good discussion about abstract 1673, and I would like to thank again Dr. Sabrina Hamroun, for joining us today and sharing her time with us. This has been Sheila Reyes. Follow me on Twitter at Rumarampa and tune in to Room Now for more reports and videos of the ACR Convergence 2022. Thank you.